Hello, Gold delegates from around the world. Welcome to Gold Lactation 2015. I'm Fleur Bickford, Program Director and MC for Gold Conferences International. I'm here today chatting with Dr. Martin Kaplan about his upcoming presentation titled Infant Phrenology for the Clinician. So Martin, welcome. We are thrilled to have you here with us today.
I'm glad to be here. Thanks for inviting me.
Okay, so just wanting to chat a little bit about your upcoming presentation. Really excited to have you speaking for us this year. So first question I have for you is just wanting to know a little bit more about yourself and your journey, and just wondering how you became involved in laser dentistry and what led you to take a closer look at the treatment of tongue ties.
Well, let's see, approximately 14 years ago, I started to get some interest in high-tech dentistry, and lasers started to become a little bit more prevalent. So I took a one-day class on lasers to see if it would be something I could utilize in pediatric dentistry. And when I sat in on this class, which was on a soft tissue laser called the diode, they started to talk about certain types of tissue procedures that we could do on children and adults that most people were doing just with surgical blades before. And I saw that there was a great potential in this. So after that one particular class, my interest peaked. I then attended a two-day training class to get standard certification in lasers at Tufts University in Boston, and then from there I decided to join the Academy of Laser Dentistry, where I became standard proficiency involved, and then I started getting more involved with laser education, learning how to use lasers. And at one of these sessions, I attended a pediatric class, which included treating infants with laser phrenologies, and just a light bulb went off in my head that this would be a great way to be able to expand what I can do for my child patients and also infants. And they were getting tremendous care, which was much better than using a blade or a scissors to treat the frenum. And I've been doing this now for approximately 12 years.
Wonderful. So next question to you is, when it comes to laser dentistry, it's still something that's fairly new. So wondering, what do you think the biggest myth is when it comes to laser dentistry?
Well, the biggest myth is that you can pick up a laser and start using it right away, or that it's a hugely expensive piece of equipment and it takes a long time to learn. There is certainly a learning curve for everybody to learn how to use lasers, but not all lasers are the same. Currently, the biggest myth that I think going around that involves this particular subject we're talking about today is just because a dentist has a laser, that all lasers aren't necessarily the right laser for the tissue that he's using the laser for, especially for infants. So there are different types of lasers, which we'll go over in my talk, and the lasers have certain capabilities for certain types of tissues, and if you're not well educated, even if you have the best laser that's out there, if you don't know what you're doing with the laser, you're not going to get the results you need. So it's education, 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 and that's where I think one of the biggest myths.
Okay, thank you. Definitely so important for anyone dealing with infants to be well educated about what they're doing. So really looking forward to hearing more about that. So my last question to you is, what do you hope delegates will take away from your presentation?
Well, I think the most important thing is what I've been finding a lot, that everybody thinks, not everybody, but the biggest concept out there is every frenum needs to be treated. There's currently a lot of concerns that dentists or even physicians are over-treating frenums because they're being overdiagnosed. It's all of a sudden a new fad of dentistry and medicine to start clipping frenums. And I do think some people are getting on board this particular subject just to treat for the sake of treating, but what I want people to take away from the slide presentation that I have is that you have to be objective. You have to have protocols to go by. It's not just a matter of seeing a frenum and treating it. You have to know what the mother's symptoms are, the baby's symptoms are. You have to have objective protocols to decide when to treat, and some areas that have frenum that look like they're tight. May not actually be a frenum at all. It could be something where you need a chiropractor or a cranial psychotherapist, or there's some other team members involved, or even lactation consultants who can help with the breastfeeding, because it may not truly be a frenum issue. It could be some other organic issues or anatomical issues. So I just want people to understand that there's different ways to evaluate what needs to be done. And if there's a surgical approach, you have to know what you're doing and the reasons why you're doing it. Because just because you see a frenum, it doesn't mean it needs to be treated.
Okay, thank you so much, Martin. I agree with you. So important for all of us to be looking at the big picture. So thank you so much for taking your time to chat with me today about your upcoming presentation.
You're welcome.
Really excited to see more. And for our delegates that are listening, you will be able to learn more and hear Martin's presentation as part of our Structure and Function add-on, which is available in conjunction with the main lactation conference. So we look forward to seeing you online. Thank you.
Thank you.